All right. So we are live on Facebook, and here we are back on Zoom with Dr. Bruce Daggy. So it's my real honor to do this episode of the Business of Health. Dr. Daggy and I have worked for many, many years together while he was at Shaklee. You know, we met, I think, in Chicago, wasn't it, Bruce?
Yes,
Remember,
over a lunch in Chicago.
at the Lagoni Ferguson Trust, everyone else conference. And we got to talking and we were kind of trading backgrounds. And he said something like sustainability. And I said, "You're into that too?" Oh my gracious. It was like finding a brother in the secret societies. we have shared an awful lot. Bruce was very important to us for many, many years at Shaklee, formulating products, being a tremendous advocate in the field. He would come and talk for us in Boston. He was just a real treasure. So Bruce, why don't you help me out by sharing your slides and popping up your first slides so I can get your CV correct. Okay, so tonight what we're going to be doing is talking about, well, didn't we think this title was very clever? Science-based hacks for feeling better and losing weight. But that's not the half of it. This is going to be a very rich presentation filled with a lot of really, really excellent material. And Bruce has a stellar background, academic background. He is currently an adjunct professor of nutrition at Florida State and former senior VP and R&D chief science officer with Shaklee, former chief science officer for Nutrisystem, and a former VP R&D for nutrition and weight control at GlaxoSmithKline. So pretty stellar background. And so Bruce, why don't you just take it away and talk to us about how to be healthy? Because that's really what we're about, isn't it?
Right. Thank you, Bob. Thanks for the introduction. Hello, everyone. Glad to be with you this evening. I want to start by a little personal ground rules. What I'm going to say today, these are just my opinions. I'm not representing any other organization. I also don't practice medicine and I don't do personal nutrition counseling. I'm a research guy. I'm an R&D guy. I was involved in a lot of clinical research, as well as some of the product development, as Bob was mentioning. But I'm giving you that kind of scientist perspective on these questions. I hope you will hear some things that I say, some ideas on how to have a good working relationship with the people who are your healthcare professionals, because I think that's really important too. So I hope that'll be one of the things you take away. So we're gonna peer into the box that is the U.S. healthcare system and how you can make it work better for you. And I think one way I want to start that is really going back in history and understanding how did our healthcare system get to be the way that it is. And I think this quote from Thomas Edison, 1902, is a good starting point. This is a real quote from Thomas Edison. I looked it up, I've confirmed it. And it's one that many of you may have heard before, this part of it anyway. The doctor of the future will give no medicine, but will instruct his patient in the care of the human frame, in diet, and in the cause and prevention of disease. There were never so many able, active minds at work on the problems of diseases as now, and all of their discoveries are tending to the simple truth that you can't improve on nature. Well, that's language that resonates with a lot of people I know who are into health and wellness and diet and, chiropractors, and, it just sounds so fundamentally positive and holistic. However, it's not the full quote. And if you just see this part of it, you're really not getting the story of what Edison was trying to say that day. Here's a little bit more of the quote that's not included in this version of it. 1903 will bring great advances in surgery, in the study of bacteria, in the knowledge of the cause and prevention of disease. Medicine is played out. Every new discovery of bacteria shows us all the more convincingly that we have been wrong, and the millions of tons of stuff we have taken was all useless. So when Edison was saying medicine, it wasn't medicine as we think about it today. It was the patent medicines of his day, which, another word for it, snake oil is often applied to those products. So what Edison was saying that was the new revelation is what we call germ theory, that many diseases were the result of microscopic organisms that we weren't aware of the significance of before. Even in 1902, viruses were unknown, but bacteria were known, and it became known that some diseases were of bacterial origin. So that's what he's saying. Germ theory is real. We know it's real. We got a lot of people working on it. We're discovering more and more about bacteria every day, and that's going to be the answer, as well as surgery. Okay, and just to finish the quote, because the whole quote's really very interesting. In green here, they may even discover the germ of old age. I don't predict it, but it might be by the sacrifice of animal life that human life could be prolonged. And this is coming true. We do now actually understand a number of the mechanisms of aging. And there's a lot of work going on to slow down or even stop the aging process. And as far as the sacrifice of animal life, it wasn't too many years after this quote that porcine insulin was used for managing diabetes. And we've had cases of organ transplants even from non-human species to humans. So that also has become somewhat true. And finally, surgery, diet, antiseptics. These three are the vital things of the future in preserving the health of humanity. There were never so many able, active minds at work, ... You can't improve on nature. So there it is. Diet made the list.
There we go.
It's right there. It's right there in the middle. And you can't improve on nature. So that whole idea, study nature, learn from nature, apply what you learn from nature, it's all built into his answer. But unfortunately, in the development of our healthcare system, that little thing about diet really got dropped. And it got dropped in large part, because of those patent medicines. The solution that the government came up with to get rid of patent medicines, which absolutely needed to happen, was from 1906 until 1990, if an ingredient or a product prevented or treated a disease, that product was a drug. Food could not do that. So if you were in the business of selling food and food ingredients and you made health claims in the United States between 1906 and 1990, you were breaking the law. So, again, well-intentioned, it was solving one problem, it created another problem. And, people like to say that the supplement industry isn't regulated and, or even that foods aren't regulated. And there are times I would say not well regulated, but here's a list of the major supplement regulations in the US from 1906 to 2011. This is from a paper I co-authored. There's a whole lot of regulation of supplements, at least on paper. And again, all of these regulations between 1906 and 1990, you could not make a health claim for any nutrient or food product. And in 1990, 1994, laws got written that began to change that. So now there are some claims that can be made. And, I think that's a good thing because, there's this ancient wisdom that basically says what we put in our bodies every day makes a difference to whether we're healthy or not. It's not the only thing that makes a difference to whether we're healthy or not, but it is a significant factor. And so the fact that for the better part of a century, you couldn't say that as a food manufacturer or a supplement manufacturer was problematic. And now, we're continuing to struggle as a society with how do we do this in a way that people get accurate, helpful information about their dietary choices. So it kind of brings me back to the current healthcare model, and it's really, in my opinion, not very good. And why is that? And I would say that the father of our healthcare system was this gentleman, who some of you might recognize as Henry Ford. And you might not think about Ford as healthcare, but when Henry Ford came up with the Model T and the machine to build it, the assembly line, the conveyor belt, that was so radically different and so successful that it influenced virtually every other industry. The way that everything gets made, the way that everything gets done. Even the idea of home economics was trying to look at the housewife and how she could behave more like a Ford factory and get more things done. So our healthcare system, people in our healthcare system looked at this model and said, this has got to be the way it should be done. And if you ever think about what it's like when you go to see your primary care physician, are you not on a conveyor belt? Your doctor probably has about 2,400 patients. You're just, one file out of about 2,400 that doctor has. Most visits are not for prevention, they're for treatment. Some people are going in for a complaint. So here's the conveyor belt. The receptionist takes your, signs you in and takes your insurance information. A nurse takes you for your vital signs. A doctor has maybe 5 minutes to do a diagnosis and maybe some monitoring. We'll probably order some additional tests. We'll almost definitely write you a prescription or two. We'll refer you to a specialist and then rinse and repeat. That's the business model of primary care. And most of these doctors have received little or no training in nutrition, nor are they, for the most part, there are some exceptions now, but for the most part, they are not compensated financially for diet and lifestyle coaching. That's not the model. That doesn't fit onto the conveyor belt. And this is an example I've used before about why they're not trained in nutrition. I went to Cornell for graduate school. Cornell University Medical College is in New York City. Cornell Division of Nutritional Sciences is with the Agriculture School in upstate New York. Under best case scenario, it's a 4-hour drive. So you get your medical degree from an Ivy League school, and maybe you had an afternoon of training in nutrition. That's it. They just don't get it. And what they don't get, they don't realize the importance of. Now, a lot of doctors do realize they need to know this, and they pick it up later in continuing education, and good for them. But it's not an integral part of their training in medical school. So we've got this amazing assembly line, thanks to Henry Ford of medicine, and we all get on it. And as Aldous Huxley said, medical science has made such tremendous progress. There's hardly a healthy human left. If you look in this country, just take type 2 diabetes and pre-diabetes. There's what, 300 and some 100 million people, adults in the country. 100 million plus have type 2 diabetes or pre-diabetes. Then there's high cholesterol, hypertension, liver disease, you name it. So many people are on polypharmacy, taking multiple handfuls of prescription drugs every day, especially people over the age of 50, very, very common. It's not really working for us very well. It's certainly not working for prevention. And so we really have a sick care system, not a healthcare system. It's a very expensive way to obtain poor results, and creates a series of perverse incentives for doctors, hospitals, and pharmaceutical companies. I won't be so cynical as to say they want us to be sick, but if we weren't sick, their business model wouldn't work. If you just took away type 2 diabetes, it would be a financial catastrophe for the US healthcare system. Hospitals would close. Pharmaceutical companies would go out of business. I mean, it would be devastating if we lost type 2 diabetes, which is a perverse thing. Okay, so what's the way forward? Now I'm going to get into hopefully some solutions, at least at the individual level. The first one I think is to have this attitude. Yes, you probably have a primary health care provider, a physician, a personal physician, but you are your true primary health care provider. Ideally, you're not seeing your doctor every day, your physician every day, but you see yourself every day. You know how you truly feel. You know what your habits are. You can self-monitor what you're doing and how you're feeling. You can make changes. You can tell your doctor that you want to be an active participant in managing your health care. You can ask your doctor to explain your risks, to actually measure your personal risks, not what's typical for someone your age and gender, but you know, what do I have to be worried about? You can tell your doctor, if it's true, that you're willing to make changes, and you may need to seek out a different doctor. If you start having this conversation, you might find that your doctor's kind of old school and doesn't want to have this conversation with you. You may need to look for a doctor that wants to work with you this way, but you are really primarily responsible for your health. And now I want to talk about some of the big things that as a country, as users of the healthcare system, some of the big things that we need to do or that we can do. And number one, for almost anybody who smokes, the very most important thing you could do for your health is to quit. And it's also good for the people around you who are breathing the smoke that you put out. You quit or at least cut back. And this is one of the landmark successes of public health in this country ever. If you go back to 1964, when the Surgeon General report came out, 42% of U.S. adults were smoking at that time. Now, as of 50 years later, that had fallen to 18%. In recent years, it's been inching up again. This is partly the appeal of vaping and getting kids into it again. And by the way, I don't think vaping is as dangerous as smoking cigarettes, but addiction to nicotine is still a concern, and where that's going to lead. But there was no magic bullet that caused this improvement. On the slide, I show an advertisement for Lucky Strikes. Doctors, physicians say Lucky Strikes. The laws that limited cigarette advertising, limited where you could smoke, the taxes that were put on tobacco, etc. There's a whole series of measures over time that made smoking less appealing, not simply telling people that smoking was bad for them. So there's a tremendous public health success. But if you smoke, please, this is something that you really, for your own good and for the people around you, you need to focus on. Okay, that's one. Bob said we were going to talk about obesity, and some of you may remember this. When I was with Shaklee, my very first global conference, I put up this slide, this photograph from my family archive. This is some of my ancestors about 1910 at a harvest scene in Virginia, and there's a mule and a couple of horses, but there are 11 men and boys in this picture. And as far as I can tell, not one of them is obese. Maybe there's the older gentleman sitting down might have a little bit of a belly, but they're mainly pretty lean. Even the ones that I know were in their 50s when this picture was taken. They weren't going to the gym after work. They weren't members of Weight Watchers. They were just, living in a world where obesity pretty much was not a problem for anyone, almost anyone. And it's not that many generations ago. The problem of obesity has, no pun intended, really been growing for the last 30, 40 years. And that means it's not our genes, it's things that are more lifestyle related, and some of them we should be able to do something about. Very important in terms of public health. So This is a gentleman, before and after picture of a gentleman who was in one of the clinical trials that Shaklee sponsored. This was a 6-month weight loss study using the weight loss program Shaklee 180 combined with a physical activity program, which I'm going to describe. And this is not results typical. This fellow was the star of the show, but I am going to show you what the typical results were as well. And what I want you to see in his individual results, he did lose weight. In pounds, he went from 235 to 190, which brought his body mass index from the low end of obese down to normal. His waist circumference decreased by almost 8 inches. His hips also got smaller. But here's the really important stuff for me in terms of the health outcomes. His blood pressure normalized. His cholesterol went down. His triglycerides went down. Hemoglobin A1C, which is a marker of insulin resistance, an indicator whether you're on the path to diabetes, that also improved. So metabolically, he was much, much better with this just nutrition and exercise program. And Bob, I know you sent me a slide, similar slide, another person you know who went on the same program outside of the clinical trial.
Yeah.
And again, just remarkable results. The weight loss you can see in the picture, the 2016 versus 2017, but also the cholesterol coming down, the triglycerides, the HDL, which is the good cholesterol, going from too low into a very nice range, LDL coming down, and so forth. So this is why weight loss matters, and it's not just weight; it's really body composition, which is what the study is going to talk about. So this is the published, peer-reviewed, published study from the first gentleman that I showed you, that he was a participant in. Dr. Wayne Westcott was the principal investigator, and working with Wayne was Rita LaRosa Loud, who developed the physical activity component and supervised the subjects in their physical activity routines. And if you're interested in reading the paper, it's available at healthresource.shaklee.com. It's you can download the whole thing and read it at your leisure. So again, it was a 6-month study, and now I am going to talk about what were the average results. And this is what was really remarkable. On average, all of the weight loss was fat loss, was body fat, and that is not typical, as I will show you. And they gained muscle, which is not typical, as I will show you. So the group that got Shaklee 180 plus exercise for 6 months lost over 14 pounds of body fat and gained about 3.7 pounds of muscle on average. And it was very good tolerance to the program. People complied. People told us that they enjoyed it. And again, importantly, the risk factors all moved in the right direction. So blood pressure, both systolic and diastolic, fell in this group. Their waist circumference fell. That's an independent risk factor for a lot of problems. Their total cholesterol went down, their LDL went down, their triglycerides went down, the hemoglobin A1C, again, that marker of insulin resistance, that went down. And of course, body mass index went down. Now, this slide is a little complicated, but it really summarizes the findings in the study. So I want to show you. When we saw this result about the fat loss with actual muscle gain, I'd been working in obesity for a while, and that just blew my mind because I said, I don't think this is typical. So we went back to the literature and we found 20-some weight loss studies that included measures of body composition, as this one had. And a lot of studies only look at weight. They don't look at body composition. And again, what you really want to do, you don't want to lose muscle. You don't want to get to normal body weight because you lost muscle. You want to get to normal body weight because you've lost fat. So going from left to right across the top, This is increasing weight loss in kilograms, and a kilogram is about 2.2 pounds. So if you've lost 10 kilograms, you've lost 22 pounds. Okay, so that's across the top, and down the bottom is also change in mass, but this is not total body weight. These curves are lines are looking at body fat, which is in green, and lean mass or body muscle in blue. And the dots are individual clinical trials. Okay, so what happens as you lose more weight, okay, more body weight, you lose more body fat. Well, that's a good thing. That's what you'd want to see. More weight loss, a lot of it is fat, but not all of it is fat. You tend to lose muscle at the same time. Not as much, but you're losing muscle. When you lose muscle, your metabolic rate is falling because muscle burns a lot more calories than fat does. So it's going to make it harder to continue losing weight. It's going to make it harder to keep the weight off if you've lost muscle. So this is looking across about 20 clinical trials. You see a few where muscle was retained, but the weight loss wasn't as much. And those were probably more exercise studies than exercise and diet studies. Okay, so that's what's typically seen. What happened? What happened with Shaklee 180 at 6 months? Well, the horizontal red line shows the fat loss. They lost about 6.5 kilos of fat, that 14 pounds I talked about. So that intercepts the fat line here. So what you would predict based on the previous studies is that they would have lost about 1.5 kilos of muscle. So that's about 3 pounds of muscle. But what they actually did is shown at the star, they gained muscle. So instead of losing muscle, they gained muscle. That's a huge difference in terms of their metabolic rate, what's going to happen to their metabolic rate. So that's really going to help them in terms of weight maintenance and in terms of the metabolic benefits of the program that they've been on. By the way, it's the examples I showed before were both men. This is a woman who was in the clinical trial. So there were both men and women. It worked both for men and women. No surprise, but I just wanted to show that. And here's what really struck me about this study. And I think this is a very important, in terms of a hack, a life hack, this is a very, very important takeaway. Because I think a lot of us think, and you see this in the first week of January, people think they have to go to the gym every day, right? And do so many reps until they just are dying and can barely crawl back to their car. This was an exercise program that was 2 days a week. It took about 40 minutes each time. There was about 20 minutes of aerobic exercise on a treadmill, brief run, walk kind of treadmill exercise. And then there were machines to exercise the major muscle groups, but it was the weight, the resistance was set. So you were just doing one set to exhaustion, about 8 to 12 reps. That's it. Not 3 sets of 20, not 5 days a week, 7 days a week. No, twice a week, very few reps, but working the muscle to the point where the muscle knows, gee, I got to get stronger. I'm being asked to do something. I've got to get stronger. That's all it took. And actually having days off lets them recover and gives the time for that improvement to take place. This was really striking to me, that this minimal intervention, not taking a lot of your time, could be enough to do it. And by the way, Rita also developed a at-home version of this. It didn't require the machines, so which turned out to be very important for a lot of people during the pandemic when the gyms were closed. You could do this at home just using a chair and some bands and the weight of your own body, and still get these kind of benefits. The study also included a weight maintenance program. For 6 months, we continued to follow these subjects, They continued to do the same resistance exercise program twice a week, but instead of being on the full Shaklee 180 program, they were just using one meal replacement protein shake as one of their meals each day. So a little, like just a little help with longer term dietary compliance by having one meal that you knew was solid in terms of its nutritional component. And again, it was remarkable because you expect to see some weight rebound when people have come off a weight loss study. That is so typical, it surprises no one. They did gain back 1.5 pounds. So you say, aha, yeah, that's what you'd expect. But no, because everything that they gained back was actually muscle. They continued to lose body fat, and they continued to lose off their waist and off their hips, but they were putting on muscle. So their body composition, excuse me, gotta have a sip of water. Their body composition continued to improve. So again, this is just remarkable, but it shows the power of a good intervention. And one reason I think the program worked well is that the composition of the foods were carefully formulated. So we eat a lot of foods that are too high in sugar, that cause big spikes in blood sugar, also too high in other things. We're going to talk about this in a minute. The shake in this program was formulated to be what we call low glycemic index. And what that means is when you consume it, instead of getting a big jump in blood glucose, as you see in the control, the heavy dark line here, 30 minutes after ingestion of the glucose control, there's a big spike in plasma glucose, and then it comes down, and it comes down so fast, it actually overshoots. And so 90 minutes after, you're feeling bad because your blood sugar's gone low, and you want to eat again, right? We tested 3 versions of the Life Shake, and the glucose spike was much lower, and there was no overreaction. The blood sugar just kind of went back down to right around baseline and stayed there. That's what you want to see. And that's why in a maintenance mode, you can do this forever. This is not an unhealthy way to make a dietary improvement. You can do this for the rest of your life. And so that brings me to the last hack I want to talk about, and that's that our diets are really not where they should be. Our food supply is not what it should be. This is another thing that Bob and I have in common. We grow our own food. We support local food systems, and we work on real food. Most of the U.S. population is eating a diet that is too low in fruits and vegetables and whole grains, and just deficient in a number of ways, not meeting our requirement for multiple nutrients. And yet we are also exceeding the recommendations for things like added sugar and saturated fat and sodium. So the diets are really way out of whack from where they need to be. Now, my solution to that was to marry this lady, but we can't all do that. But believe me, I eat a lot more fruit and vegetable than I used to, and she also makes me grow a lot of it. But that can't be for everybody. But it's been a good solution for me. But I kind of grew up not really liking my fruits and vegetables, to be honest with you. But I got a degree in nutrition, so I knew I needed to do it. So I started out with the grumpy approach and just said, well, I've got to suck it up and suffer. I don't really enjoy this, but I know I got to do it. And of course, that's not a really good way to comply day in and day out. So over time, I learned that, well, there's some salads I like, and there's some soups I like, and there's some side dishes I like, and there's some snacks I like, and it can be slipped in. This is when Anne hides the carrots in the sauces or whatever, and I don't even notice. And then finally, the smoothies. If you have a good blender, like a Blend Tech, that is really high shear, you can get a lot, not just vegetables, or not just fruits, which I think a lot of people think about putting fruit in a smoothie, but you can hide a lot of vegetables in a smoothie as well. I've eaten a lot of broccoli for breakfast, and not even noticed. I love it in a good smoothie. I think this image, which looks kind of pinkish, I think this was after Thanksgiving, and we had some leftover cranberry sauce. So you can put a lot of things in a smoothie, and it can just taste delicious and be so good for you. And you're also getting the hydration. It's a great way to have one of your meals. So we have a lot of these, nutritional gaps, gaps in essential nutrients like vitamins and minerals, but also in what I would call key nutrients that are technically not essential, but may be pretty important for you, like some of the carotenoids that are important for eye health. Maybe I could live without them, but I don't really choose to be blind. So, I want to look after my eyes. So we can use supplements and fortified foods to help close the gaps that would otherwise be there in our diet, that can help us adjust some of our risk factors. And, people are not resistant to this idea. Most US adults are open to taking supplements, including most doctors and nurses. I mean, it's not a fringe thing to be a supplement user by any means. So, with that, I want to just summarize what I've been saying by this. We want to prevent disease. Sometimes you're going to get sick, and you may have to see your doctor, and you want to recover. But I think we would all prefer to be healthy and stay healthy for as long as we can. And so to do that, you need to understand what your risks are. And this is where working with your doctor is very important, and acknowledging and paying attention to how you feel and what you're doing to know your risks and then to manage them. Eating the best diet you can, exercising regularly. But as you've just seen, that doesn't have to be a major time commitment, and some of it you can build into the activities of daily living. If you can walk or bike somewhere instead of getting in your car, that's still exercise. So, but we need that component, and it needs to include resistance, not just aerobic. Work to achieve an optimal weight, supplement wisely. We could talk about all of these things in much more depth. And finally, find your community. The Blue Zones people talk about this a lot. I think it's so critical to surround yourself with people that care about you, care about your health, your physical health, your emotional health, your spiritual health, and that you care about theirs, and together you look after each other. I think that's just so critical. So there is no magic bullet. There is no one thing. I really dislike the idea of superfoods or super drugs in general. I think it's a practice. It is bringing together the different elements that gives you the best opportunity to build and maintain your health. And again, we'll have plenty of opportunity to talk about all these issues in greater depth in future talks.
So great. Bruce, thank you very much. Maybe you can stop share so we can pop ourselves back big. And I have figured out, sorry about the little disruption there. I'm getting the technology right. I just realized that if I turn down the volume on my phone, I could see the comments there. There's some questions. So if anyone is watching, and I know that there are, because there you are. If anyone's watching and wants to pop a question into the chat in the comments on Facebook, you can do that. And folks, I'm going to pop up the chat. So if any of the people who are on with us on Zoom, if you have any questions or comments or whatever, but particularly questions, that would be great. Let's see here. Lisa says, did the participants in that study take the shake with water, or did they add other things like milk, beverage, fruits, etc.?
We talked to them. We had some weekly, or maybe it was bi-weekly sessions with the subjects so that we could answer their questions about how to comply. And they, I don't think they necessarily did it any one way. There were different approaches that different people took. So some people, I think, did make smoothies. Some people just had the shake according to the label directions. We weren't overly prescriptive that way. We just, we were giving them rough guidelines to, move them in the direction of the diet.
Right. So, are there any other questions?
I can see one that's just popped up.
Okay, all right.
Almond milk and oat milk and others. So one thing, from Susan, just see the question. So some of the milk alternatives are very low in protein. One that isn't is soy milk is close to cow's milk in terms of protein content, but some of the others have very little protein. And so if you use one of those, then the question would be where is the rest of the protein coming from? So it depends on which shake you're using. It's a good idea. First of all, I think it's a good idea to eat breakfast. That's somewhat controversial, but that's a whole nother. We could spend an hour on that topic. But I think it's a good idea to eat breakfast. And if your meals contain at least about 20 grams of protein, and you're dividing that, across the day, then you can get your daily protein requirement very easily. The other thing that you need at least one meal a day where you're getting a nice slug of fat, because that helps your gallbladder contract. And that's important too. Again, longer subject. So, so you could make you could start with your protein powder, your mainly protein powder, and you might look at what you could add to that if you're using that in a breakfast occasion. What you could add to that to add a source of fat, and and then you can add, again, fruits and vegetables as well.
Great. And again, I'm still learning the tech. On a meeting, everything is in the chat. In a webinar, everything is in the Q&A. So if anyone has a question, go over to the right side of your bar on the bottom and go to Q&A. My apologies. So yes, okay. So most of the stuff in the Q&A is telling me that go to the Q&A. So I finally found it. Any other questions or thoughts before we wrap up? That was a good question. All right.
Okay. Paula has asked, what would you say to someone considering bariatric surgery? That's a great question. I have friends who have undergone bariatric surgery for whom I would say it has absolutely saved their life. Sometimes you are so far kind of into the red in terms of your health and your metabolism that could be the best option. So and the surgeons have gotten better, but it is a drastic thing. It is it often works if you got the right kind of bariatric surgery. It's fairly safe. The outcomes are usually good, but it has lasting effects, and that some of which are positive, like in terms of things like risk of diabetes, but challenges in terms of micronutrient deficiencies, for example, that are permanent. So it's not something to do lightly, but I would never say that it's wrong for everybody. I think for some people who have tried everything else and are just at that kind of point of desperation where their life really is in jeopardy if they can't find an answer, then bariatric surgery could be the right thing for them. It's a hard decision. They really need to ask a lot of questions go into it eyes wide open. But for some people, I'm afraid it is the right answer. Yeah.
So Bruce, I got a question here from Linda. In the study, was there any distinction between people's dietary choices, like were any people vegan? I mean, did you track the actual nature of their diet outside the study, or just they ate whatever they ate?
Boy, I'd have to go back and look. I think there certainly, I'm pretty sure there were several people who were vegetarian. I can't remember if they were vegans. Um, I'd have to go back and look and see. If there were, I'm not even sure it's mentioned in the paper, but I'm pretty sure there were some vegetarians.
Yeah.
And this particular program, the Shaklee 180, can accommodate vegetarians. So that's possible. Vegetarian diet, I'm largely vegetarian. I guess maybe I'd say I'm a flexitarian. I do eat some meat, and I'm lacto-ovo vegetarian, so I'm not a strict vegan. But I eat a lot of vegan meals. I like the vegan approach in general. I find a lot of that to be very healthy and very tasty. If you do go all the way to vegan, I think you do have to supplement. At least I think even the people who are anti-supplement would say, well, vitamin B12. It's hard to avoid deficiencies. And if you're a vegan, you can get fish oil omegas now by algal oils, but I don't think it's sufficient just to get the nut omega 3s, the ALA. You want to get some of the long chain. So vegan diet, a strict vegan diet, takes some thought to close some of the gaps.
So Bruce, Lisa has a question. What percentage in general, and I realize that it varies, but in general, what percentage of a person's diet, good healthy diet, should be fats? And of course, the corollary question is, what kind of fats are good fats and what kind of fats?
Yeah. I worry more about fat quality. The U.S. diet doesn't have as much trans fat as it once had, and for those who don't know, there was a recognition years ago that saturated fat and cholesterol were problematic, and this is back when people were eating a lot of food, based on lard. My mother, I'm sure, used to make pie crusts using lard. It's very, very common, and it became the research was showing that wasn't good for us, and that's why we got Crisco. So Crisco was to taking vegetable fats and hydrogenating them so that they became more saturated, so that you could replace all that evil animal stuff. Well, when that was done, nobody realized that some of the natural fats in those oils then became trans fats, and that was even worse. So good intentions, bad outcomes. So we do need some fat in the diet. But I think more about fat quality than I think about fat quantity. So I don't eat a lot of red meat. In fact, I eat very little. That's partly because of the fat. That's partly because of the iron that I don't need. Too much. You don't want too much iron in your diet. If you don't need it, you don't want it. Yeah, for men and women after menopause, unless you're bleeding, you have an internal hemorrhage and your doctor says you're anemic, you don't want to be taking too much iron, because that's really not good for you. So, and then there's the whole question about how are cattle raised and that sort of thing. I think there are better ways and worse ways to do that, and that's a whole nother conversation. So I do occasionally eat meat, but I treat it more as a condiment than as a cornerstone of my diet. So back to the question about what kind of fat and how much fat. I think again, you need some, just to get your gallbladder to contract. You need some because there are essential fats. The omega-3s and omega-6s are essential. Very few people in this country are not getting enough omega-6. And so we don't talk about that much. If anything, we get too much. But a lot of people don't get enough omega-3 unless they supplement. And there are actually good reasons not to eat fish all the time because we've contaminated the oceans too much. So, particularly, pregnant women, I would say you don't want to be eating fish more than twice a week at most, because you just can't know unless you've got a mass spec in your kitchen and you're measuring the mercury levels and the everything else that's coming with the fish. You don't want to be eating fish on a daily basis, but you want to be getting the omega-3. So you have to, in my opinion, you have to supplement. And if you're a vegan, you could look for an algal oil, which is where the fish get it, because the fish can't make it either. But if you're okay with having fish, then you can get a fish oil that's delivering the EPA and the DHA. For Shaklee, that would be Omega Guard or one of the strips. But again, Shaklee also offers the vegan alternative.
Great. All right. So let's see here. Okay.
Oh, okay. I knew somebody was going to ask. I see Sue and Jeff have asked about the VITAL study. For those who haven't heard, this is published in the New England Journal of Medicine. Has been in the news the last couple of days. A big controlled study of vitamin D supplementation with and without calcium that surprisingly showed no benefit on bone fractures. I have not had time to read the paper. I am surprised at the result. I can think of a few reasons why they might have gotten this result. I would just maybe take 2 minutes to say, it's very hard to do these studies. It's very hard to do a long-term intervention in nutrition in free living people who have the diets that they have, who change their diets, who may tell the study personnel that they took the products they were supposed to, but they actually flushed them down the toilet, or told them that, no, I didn't take any other supplements, but oh, in fact, they did. And I think there's also the fact that studying 1 or 2 nutrients at a time is probably not the best way to do it, because nutrients all interact with each other, and there's 15 or 20 nutrients that affect bone health, not 1 or 2. So if you don't know what is happening with all the other stuff that they're eating, and for that matter, their adherence to load-bearing exercise, or other things that they're doing that could affect their risk of bone fracture, then it's really hard to know. So I will have to read the paper and see exactly what it suggests. But when I heard the headline, and oh, by the way, also in that article that I read was I think the New York Times article, several doctors said, yeah, but I'm still going to tell people to take their vitamin D. It's safe, it's inexpensive. Even though this study didn't show a benefit, other studies have shown a benefit. What's the downside? What's the downside? So,
and Bruce, just to interject, doesn't vitamin D have something to do with other functions of our body?
Yeah, that's right. Not only is it more than one nutrient, but it's right. Nutrients don't do just one thing. So that's the other thing. I mean, every time there's another study questioning the benefit of fish oil, I have the same thought. Fish oil, I don't take fish oil for one reason. So you do a study and you're studying one benefit and you're ignoring everything else, then
7 levels, right?
Right.
Well, Steve Cheney, Dr. Cheney from University of North Carolina, Professor Emeritus, told me one time, we had a lot of conversations. He said, you can show that there is incontrovertible statistical evidence let's say an increase in calcium is associated with a decrease in a whole bunch of different diseases or, maladies. But if you try to extract that and study the action of calcium on that particular thing, that it rarely, if ever, works out, because for all the reasons you pointed out, it's really hard to do.
These studies are incredibly difficult. I have sympathy for anybody who tries to do it. I did a study once. It was a very small clinical trial. It had, maybe 20 subjects. And without going into all the details, we had strong reasons to believe that 2 of those subjects lied. They were supposed to collect samples that they didn't collect, and they just said, no. I don't want to be too graphic, but that they could not collect the sample. The samples didn't exist, and it was impossible. We knew they were lying, but you can only ask them once or twice, and they said no. We complied with the study, and they destroyed the statistical power of the study. 2 people was enough to destroy the statistical power of the study, so we had no finding. And I've talked to many investigators. I could give you countless stories like that, with people who appear to be perfect subjects, doing everything according to the protocol, but then one time their wife comes in with them and says, "Oh no, he just throws all those pills away." So that's what you're dealing with, and in addition to maybe not knowing all the things that matter. So again, if you're looking at bone health and you're only looking at vitamin D, or you're only looking at calcium, and yet bone health, as I said earlier, is affected by 15 or 20 nutrients and your weight-bearing exercise, and maybe whether or not you ride a motorcycle, and you break, you ride a motorcycle, you're more likely to break a leg or break an arm, right? So, or you're a rock climber, or you're an ice skater, so it's diet and lifestyle, and where you really started from, and who knows how many other factors. And the statisticians will try to control for all these so-called confounding variables, and it's really hard to do. And so, my guess is, the investigators set up this study expecting to find that vitamin D was good, that they were genuinely surprised they didn't find that. But, stuff happens, and maybe they got a result that they got for reasons that were out of their control.
Well, Bruce, we've been going for a bit more than an hour, and I personally could go for another hour. I don't think I want to completely burn out all of our wonderful participants the first time. What we're planning on doing is, in this business of health, the fourth Thursday, this is the fourth Thursday, is going to be devoted to actual, talking about health and physical health and all that. And 2 weeks prior, the second Thursday, we're going to be talking about the business of health, and particularly our particular business, Shaklee business. And we're going to have a bunch of marvelous people and interview them. So if people have an interest in helping people do what Bruce is talking about, because I can tell you, as a Shaklee leader, longtime Shaklee leader, my family has been in for 52 years. I've been in 45 of those 52. One of the really wonderful things is that, yes, we purvey high quality products to people, but boy, there's a lot more that goes on, including talks like this, including helping people see that, your base diet really makes a difference. Your exercise, cardio and strength training, resistance exercise really makes a difference. Whether you smoke or not really makes a difference. And so part of our job is to really be a conduit to this. This is, it is rocket science. When you look at the science, it's rocket science. But in terms of the implications for us, it is follow a diet, and maybe the next time, but so we can plan with everyone out here. Maybe the next time we can focus our attention. Okay, the base diet. What does science say about the healthiest diet? Because there are people who I respect highly say vegan is the way to go, absolutely the way to go. Some will say, no, gotta throw some salmon in there, and all that. So maybe in September we can come back, or no, this is July. In August we can come back and really talk about how do we optimize our base diet. And then we use our nutritional supplements to make things even more optimal. And I think there's
that'd be a good conversation, and personalized nutrition in that.
absolutely
regard,
personalized nutrition. And if you're going to take supplements, how do you do that in the most effective way? And we can talk about the landmark studies, because there's some really phenomenal studies that show that, yeah, people who take bucket loads of supplements, like me and my mom and other people like that, enough to rattle when we walk, we're a lot healthier. We're like a way healthier, particularly as we get older. So anyway, Bruce, thank you very much. This was a wonderful conversation, and we can kudos to you, and we have our participants. We can if someone on the Q&A wants to say great job. Okay, so Zal says thank you, other people say thank you. So all right, we'll see you all later. Next time on the 11th of October, we're going to have Marty and Cheryl Turner, and then whatever that fourth Thursday is in August, we'll have Bruce back. All right, take care. Bye-bye.